things that we are doing right now positively impacts the children and families who need our hospitals right now. And at the same time, they're all investments for the future generations of children, and help them grow to be the most phenomenal adults who achieve their full potential.
One of the things was making research a priority. We got research going in a big way, and I think that helped. Making education a priority was also important. And I guess at a more subtle level was making everybody in the hospital feel that they mattered. All the staff, from the cleaner to the intensive care specialist, that everybody was part of caring for sick children.
I guess the best day was when we changed visiting hours, when visiting was open and parents could stay by the child's bedside 24 hours a day if they wanted to.
In the years when I was a medical student, I first remember noticing the survival of childhood cancer was pretty close to nil. So it was as good as a death sentence. Now it's up to over 80% survival. So in half a century or so, we've gone from a survival of nearly 0 to over 80%. So it's been a wonderful and amazing time to be part of the discipline. I would just add a reflection on our seniority, so to speak, or the grey-haired people, that I can hope that the next generation of leaders embrace some of the visions we've been sharing and actually achieve them beyond our current capacity.
They will.
That's it. He's got the answer. That's it.
The vision for the network is to be world's best. So world's best in research, world's best in clinical care, world's best in education. Contributions from donors, bequests, and all the work that the Foundation does lets us take that up to a completely different level and really be that global leader, that world-class service that we all aspire to. And that means amazing equipment. It means supporting research, which will be, life-changing for children and their families. And if you can do that, then I just think that's the most wonderful contribution that anyone can make in their life.
As Chief Executive, when I became involved in encouraging people to leave bequests, I realised I couldn't do that honestly unless I left one myself. So I changed my will. But it's far more than that, because a lot of people think that bequests are something for rich people or for people without a lot of kids, and family is clearly an important responsibility, but anybody can leave a proportion of their estate, 1 or 2%. That's not for anybody special, anybody can do that.
I see fundraising and the generosity of the community as essential components to a high-performing hospital. So if you have a new idea, an innovation, something that adds to the total care, and you want to introduce it, the best way to do that is to attract fundraising dollars for it. I think research is the cornerstone of progress. It is the source of discovery, of translation from science to practice, and of innovation and improvement in clinical care. All those things depend on research.
I think the most exciting thing about research is it tells you what the next question should be.
Well, there was an economist who won the Nobel Prize in economics in the US, and he said if I had $1 to spend to get the best return on investment, I'd invest in children. And I think that's the answer.
I'd like to encourage everyone to leave 1%. That's what I'm doing, and that's what I encourage everyone to do, because you can make a difference.